A helping hand withdrawn, the US cuts funding. The year is 2025. The world has made significant strides in various fields, from technology to healthcare, yet some battles remain as daunting as ever. The world is still grappling with the HIV/AIDS epidemic. Despite advancements in treatment and awareness, the disease continues to affect millions, particularly in regions like sub-Saharan Africa. South Africa, a nation carrying a heavy burden of this disease, received some shocking news. The announcement sent ripples of concern through communities and healthcare systems alike. The United States, under then-President Trump, decided to slash a whopping $440 million from its contributions to South Africa's HIV/AIDS programs. This decision was part of a broader reallocation of funds, but its impact on South Africa was immediate and profound. This was a major blow, no doubt. The funds were essential for maintaining the supply of antiretroviral drugs, supporting healthcare workers, and running awareness campaigns. These funds, channeled through the President's Emergency Plan for AIDS Relief, or PEPFAR, were crucial for South Africa's fight against the epidemic. PEPFAR had been a lifeline, providing resources that the country could not afford to lose. The news sent shockwaves through South Africa. Communities that had come to rely on this support were left in a state of uncertainty and fear. People wondered, how would this impact the millions of lives depending on these programs? The potential consequences were dire, with many fearing a resurgence of the epidemic. The answer, however, was not despair but defiance. South Africans, known for their resilience, began to mobilize and strategize on how to fill the gap left by the funding cuts. South Africa, under the leadership of Health Minister Dr. Motsoaledi, decided to take a stand. Dr. Motsoaledi, a longtime advocate for public health, rallied the nation to find alternative solutions. They were not going to let this setback derail their progress. Plans were put in place to seek new funding sources, increase local production of medical supplies, and enhance community-based healthcare initiatives. This was a defining moment in South Africa's battle against HIV/AIDS. It showcased the nation's determination and ability to adapt in the face of adversity, proving that even in the darkest times, hope and resilience can light the way forward. Motsoaledi's bold stand, no more handouts. Dr. Motsoaledi, a man known for his straight talk and no-nonsense approach, stepped up to address the nation. His presence commanded attention, and his words were poised to make an impact. His message was clear. South Africa would not be brought to its knees by this funding cut. The healthcare workers, though upset, were ready to listen to his plan. He declared that the US doesn't owe South Africa a cent. This was a bold statement, one that resonated deeply with the crowd. This wasn't about pride, though. It was about taking responsibility. Communities across the nation began to discuss what this meant for them. Motsoaledi believed that South Africa had the resources and the will to overcome this challenge. Clinics and healthcare settings were bustling with activity, ready to take on the new directive. He called for a collective effort. It was a call to action for every South African to join hands and work together. Everyone, from citizens to healthcare workers to policymakers, needed to step up. The responsibility was shared, and the goal was clear. This was a bold statement, a rallying cry for the nation. The crowd's cheers echoed the sentiment of unity and determination. Motsoaledi's words resonated with South Africans. The audience was attentive, clapping in agreement with his vision. They were ready to fight for their health, for their future. The youth and healthcare workers alike were filled with a renewed sense of purpose and confidence. Taking ownership South Africa's ARV program. South Africa had already made significant strides in its fight against HIV/AIDS. The country faced one of the highest HIV prevalence rates in the world, but it responded with determination and resilience. The country had built a robust antiretroviral, or ARV program, providing life-saving medication to millions. This program was a beacon of hope for many who had been living in the shadow of the epidemic. In fact, South Africa was funding a whopping 90% of its ARV program itself. This level of self-funding was almost unprecedented in the global fight against HIV/AIDS. The remaining 10% came from the Global Fund, an international financing and partnership organization. This collaboration ensured that the program could reach even more people in need. This meant that South Africa was not entirely reliant on US aid. Instead, it had diversified its sources of funding, making the program more resilient to external shocks. The country had skin in the game, a testament to its commitment to tackling the epidemic head-on. This commitment was evident in the tireless efforts of healthcare workers and community volunteers. This existing infrastructure and funding structure gave South Africa a strong foundation to navigate the US funding cut. The country had built a network of ARV distribution centers and healthcare facilities that were well equipped to handle the needs of the population. It was time to leverage this foundation and explore other avenues of support. By doing so, South Africa could ensure the sustainability of its ARV program and continue to make progress in the fight against HIV/AIDS. Friends in need, seeking support from global partners. Dr. Motsoaledi, a seasoned negotiator, knew that South Africa didn't have to face this challenge alone. He immediately began talks with various international and domestic organizations. His list included big names like the Clinton Health Access Initiative, the Elma Foundation, and the Gates Foundation. He also reached out to the UK's Foreign and Commonwealth Development Office and the Solidarity Fund, a South African organization established during the COVID-19 pandemic. These organizations, known for their commitment to global health, were potential partners in filling the funding gap. Motsoaledi's proactive approach demonstrated South Africa's determination to maintain the momentum of its HIV/AIDS programs. Section 5. Tightening the belt. Rethinking private healthcare subsidies. In addition to seeking external support, Dr. Motsoaledi also believed in looking inwards. He knew that South Africa needed to optimize its own resources. One area that caught his attention was the government's subsidies for private medical health schemes. Motsoaledi questioned whether these subsidies were the best use of limited funds, especially given the funding shortfall for HIV/AIDS programs. He called for a parliamentary debate on this issue, urging lawmakers to reconsider these subsidies. This proposal was met with mixed reactions. Some argued that diverting funds from private healthcare would negatively impact those who relied on it. Others, however, saw it as a necessary step to prioritize the nation's most pressing healthcare needs. Section 6. Political storms, the fallout from Trump's decision. The US funding cut wasn't just a healthcare issue, it became a political hot potato in South Africa. The decision came on the heels of calls from AfriForum and Solidarity, two South African lobby groups, urging Trump to intervene in South African affairs. These groups, claiming concerns about Afrikaner culture and the government's land expropriation policies, had lobbied for US pressure on South Africa. This sparked outrage among many South Africans, who saw it as foreign interference in their country's affairs. Julius Malema, leader of the Economic Freedom Fighters, linked the US decision to South Africa's stance on Palestine. He accused right-wing groups of selling out the country's sovereignty for foreign funding. Section 7. The long road ahead. Challenges for South Africa's HIV/AIDS fight. Despite Motsoaledi's bold stand and proactive efforts, the road ahead for South Africa's HIV/AIDS fight was uncertain. The US funding cut posed significant challenges. The loss of $440 million meant potential disruptions to prevention programs, testing initiatives, and access to life-saving medication. This could potentially lead to an increase in new HIV infections and AIDS-related deaths. The situation called for innovative solutions and unwavering commitment from all stakeholders. South Africa needed to leverage its existing resources, strengthen partnerships, and explore new funding mechanisms to bridge the gap. Section 8. Homegrown Solutions, Building a Sustainable Healthcare System. The US funding cut served as a wake-up call for South Africa. It highlighted the need for a more self-reliant and sustainable healthcare system, one that was less dependent on foreign aid and better equipped to handle future shocks. This meant investing in healthcare infrastructure, training more healthcare professionals, and strengthening local manufacturing capacity for essential medicines. It also meant addressing social determinants of health, such as poverty and inequality, that fuel the HIV/AIDS epidemic. By building a more resilient healthcare system, South Africa could ensure that its fight against HIV/AIDS and other health challenges would continue with or without external support. Section 9. A defining moment, securing the future of HIV/AIDS care. The US funding cut was a defining moment for South Africa. It was a test of the nation's resolve, its ability to navigate adversity and emerge stronger. The road ahead would be challenging, but South Africa had faced challenges before. The question remained, What are the potential long-term consequences of the US funding cuts for South Africa's HIV/AIDS programs? And what strategies can the country employ to ensure the continued success of these programs? This was not just a question for South Africa, but for the world. It was a reminder of the shared responsibility to fight this global epidemic and to stand in solidarity with nations on the front lines.